Hey everyone, welcome back. Today we're diving into something pretty crucial, medical AI, and specifically how we're testing it.
Oh, yeah, this is a big one.
It is, right. So picture this. AI diagnosing you, breaking down those complicated medical reports, and maybe even being your virtual nurse.
Sounds amazing in theory.
Doesn't it? Like it's straight out of a sci-fi movie. But what if the tests we're using to judge these AI tools aren't really cutting it?
Yeah, that's a real concern.
What if we're kind of getting a false sense of security about how accurate and capable they actually are?
That's where things get a bit tricky.
It does, right?
Yeah.
That's exactly what we're going to unpack in this deep dive.
Looking forward to it.
So our starting point is this really interesting article from Science News.
Okay, I read that one, yeah.
It talks about a study in the New England Journal of Medicine AI, and it raises some serious questions. Honestly, it made me question a lot of what I thought I knew about AI in healthcare.
It's definitely thought-provoking.
And luckily, we have expert speaker here to help us navigate this whole thing.
Happy to be here.
So maybe we can start with this. Why is using tests designed for, like, medical students to evaluate AI such a problem?
Well, it's kind of like judging a chef's skills based on how well they know food safety rules.
Okay, I can see that.
You know, they might ace a food safety quiz, but that doesn't mean they can actually cook a delicious meal, right?
Makes sense.
Same thing with medical AI. Using tests like the MCAT, which is what med students take, to assess AI that's supposed to assist or replace experienced doctors.
Yeah.
It just doesn't capture the complexity of what doctors actually do.
So you're saying it's like a mismatch between the test and what the AI is actually supposed to be doing?
Exactly. And the study actually found that only 5% of studies on medical LLMs use real patient data.
5%. That's...
It's pretty low.
Yeah, that's alarmingly low. So what does that mean for patients like me, people who might be diagnosed by AI someday?
Well, it means we could be overestimating what AI can actually do, and that could put patients at risk.
How so?
Think about it. If AI is only trained on textbook cases and ideal scenarios,
Yeah.
how can we be sure it can handle the curveballs that real patients throw at you?
I see. So it's like the AI is being set up to fail almost.
In a way, yeah. And that's why researchers like Deborah Raji, who's quoted in that Science News article, are calling for more realistic testing.
So what does more realistic testing actually look like? Is that even possible with all the privacy concerns around health data?
It's definitely a challenge, but there are some promising approaches, like red teaming, for instance.
Red team?
Yeah, basically you get experts to intentionally try and break the AI
Oh, interesting.
to find its weaknesses and blind spots.
So kind of like ethical hacking, but for AI.
Exactly. It's about pushing the AI to its limits in a safe environment so we can see how it might fail in the real world.
Okay, but who would be doing this red teaming? Do you need, like, doctors who are also AI experts?
You definitely need people with a unique skill set. And it highlights another important point. We need a diverse group of people involved in evaluating this technology.
So not just data scientists and programmers.
No, not at all.
You're talking doctors, nurses,
Right.
maybe even patients.
Absolutely.
Because everyone brings a different perspective to the table.
Exactly. And by including all these different viewpoints,
Yeah.
we can make sure the AI is not just technically sound, but also ethically sound and genuinely beneficial for patients.
This is making me totally rethink how I see AI in healthcare. I had no idea it was this complex.
Oh, it definitely is. And because it's so complex, it's crucial that hospitals and AI vendors are completely transparent about how they're evaluating these systems and what their limitations are.
So being upfront about what the AI can and can't do.
Right. That's how we build trust, both from healthcare professionals and from patients.
And that transparency can help make sure everyone's on the same page about what to expect from AI in healthcare.
It's about setting realistic expectations and acknowledging that this technology, as promising as it is, still has a long way to go. It's interesting how we're in this place now where medical AI is moving so fast, but the ways we test it don't seem to be keeping up.
Yeah, it does feel like we're trying to catch up. Like we're so excited about this amazing tool that we haven't really thought about how to make sure it's actually safe and reliable.
It makes sense to be excited about what AI could do for healthcare, but it's not magic, right?
Right.
It's a tool that we need to carefully check and make sure it works before we can really trust it with something as important as patient care.
So how do we close that gap? Like what are some actual steps we can take to make medical AI evaluation better?
Well, one thing that seems really promising is moving away from these standard tests and doing more real-world testing. We need to see how these AI systems actually work in real clinics with real patients and real medical data.
Okay, bringing the testing closer to where it's actually going to be used. That makes sense. But wouldn't that be super complicated? Hospitals and clinics are already so busy, and you have to be really careful with patient information. How do you even start to do real-world testing on a large scale?
It's definitely a challenge, but it's not impossible. We could start with smaller pilot programs in controlled settings and then slowly expand them as we get more confident in what the AI can do. We could also use simulations to kind of recreate real-world scenarios and see how the AI responds in a safe and controlled way.
So a step-by-step approach with safeguards to protect patient privacy and make sure everything is done ethically. It sounds like it would take a lot of collaboration.
Absolutely. We need hospitals, research institutions, the companies that develop AI, and the government agencies that regulate healthcare all working together to come up with a way to do real-world testing that's both rigorous and ethical. It's about moving past the hype and being really careful and thoughtful about how we use medical AI.
Okay, so we need better testing methods, real-world data, and collaboration between all the different people involved. What else should we be thinking about as we figure out this whole new world of AI in healthcare?
One really important thing that we sometimes forget about is how AI might affect the relationship between doctors and patients.
That's a good point. We can't forget about the human side of healthcare. So how do we make sure that AI helps the doctor-patient relationship instead of hurting it?
We have to be really aware of how relying more on AI might change the way doctors and patients interact. Will it make it harder for them to trust each other or make patients feel like they're not really connecting with their doctor? Will patients feel like their concerns aren't being heard or that their individual needs aren't being met?
Those are some really important questions. The doctor-patient relationship is all about trust, empathy, and open communication. Can AI really do all of that?
That's the million-dollar question. AI is great at processing information and finding patterns, but it can't replace the human connection that's so important in medicine. The goal of medical AI should be to make human doctors better, not to get rid of them altogether.
So it's not about AI versus doctors, but about AI and doctors working together to give the best possible care.
Exactly. Doctors and other healthcare professionals need to learn how to use these AI tools effectively, understand what they can and can't do, and think critically about the recommendations the AI makes. It's about finding the right balance between human expertise and AI assistance.
And that balance is probably going to be different depending on the situation and how complicated the medical case is.
Right. There will be times when AI can be incredibly helpful in making decisions, but ultimately, a qualified human doctor should always be the one to make the final call. It's about using AI to empower doctors, not to replace them.
We have to remember that healthcare is about more than just data and algorithms. It's about compassion, empathy, and that human touch.
Absolutely. And those are things that AI, at least in its current form, just can't do. That's why we need to be so thoughtful and nuanced in how we integrate AI into healthcare.
It's about seeing both the potential and the limits of this technology and making sure that it's used in a way that benefits patients. We need to have these conversations now before medical AI becomes so common in our healthcare system that it's hard to change course.
I agree. And it's important to remember that this isn't just some abstract conversation about technology. We're talking about people's lives and well-being here. We can't afford to take shortcuts or use bad evaluation methods when the stakes are this high.
You're right. This isn't just about technology. It's about doing what's right for people.
Exactly. And that's why it's so exciting to see how AI is actually being used in the real world. It shows us what this technology can do, but it also teaches us how we can shape its future in a responsible way.
Okay, so let's shift gears a bit. What are some areas where medical AI is already making a difference in people's lives?
One area where AI is really taking off is in medical imaging. Think about all those X-rays, CT scans, and MRIs that radiologists have to look at every day. It's a ton.
Yeah, it must be overwhelming.
It is. But AI can be trained to recognize patterns and problems in those images, which helps doctors find diseases like cancer earlier and more accurately.
So it's like having another set of expert eyes looking at those images and making sure nothing is missed.
Exactly. And that can be huge, especially for conditions where finding them early is really important for successful treatment.
Wow, so AI could potentially catch things that human doctors might miss. Can you give us an example of how that might work in practice?
Sure. Let's say you're looking for lung nodules in a chest X-ray. Those nodules can be tiny and hard to see, so even experienced radiologists might miss them. But AI algorithms can be trained on thousands and thousands of images, so they learn to spot those little signs that could mean lung cancer.
So it's not that the AI is replacing the radiologist, it's more like it's giving them an extra tool to help them do their job better and potentially save lives.
Exactly. Yeah, and that's just one example. AI is also being used to create personalized treatment plans, predict how patients will respond to treatment, and even help with surgery. We're seeing new ways to use it all the time, from AI-powered virtual assistants that can answer patient questions to wearable sensors that track vital signs and tell doctors if something might be wrong. It's amazing to think about all the possibilities.
It sounds like AI is becoming part of almost every aspect of healthcare. But with all this excitement, we have to remember to be careful.
Absolutely. As we've been talking about, there are ethical and practical things we need to address. We have to make sure these AI systems are developed and used responsibly, always putting patient safety and well-being first. It's about using this technology ethically and effectively to improve healthcare for everyone and make it more fair and accessible.
And that brings us back to why evaluation is so important. We need really good ways to test how well these AI systems are doing to make sure they're accurate, reliable, and actually helping patients.
I couldn't agree more. We can't just rush into using new technology without asking the tough questions. That's where working together becomes crucial. We need researchers, developers, healthcare professionals, and patients all at the table, figuring out the future of AI in healthcare together.
It's about creating a shared vision for a future where AI empowers both patients and providers, making healthcare better in a way that's safe, effective, and fair for everyone.
That's a great vision and one that I think we could all get behind.
Well, listener, this deep dive has been packed with information and new ideas. We've explored what medical AI can do, the challenges of evaluating it, and how important it is to approach it with both excitement and caution. In the last part of our deep dive, we'll take a closer look at what the future holds for AI in healthcare and what we can do to make sure it benefits all of us. Stay tuned. All right, we're back. So we've talked about the problems with how we're testing AI now and how it could affect the relationship between doctors and patients. Now I'm thinking about the future. What's next for AI in healthcare? Are we going to have robot surgeons and personalized medicine for everybody?
Well, those things aren't just science fiction anymore. The progress we're seeing is really incredible. Take personalized medicine, for example. AI is already being used to look at a patient's genes, lifestyle, and medical history to create treatment plans just for them.
So, like, no more one-size-fits-all medicine.
Yeah, exactly. We could be moving towards treatments that are specifically designed for each individual person.
That sounds amazing. But wouldn't that kind of personalized medicine be super expensive? Would it be something everyone could get, or would it just be for people who can afford it?
That's a really important point. It brings up one of the biggest challenges with AI in healthcare, making sure it's fair and accessible for everyone. We have to make sure these new technologies don't make the healthcare gap between rich and poor even bigger. We actually need to use them to help close that gap.
So it's not just about making the technology, it's about making sure everyone can benefit from it. How do we do that?
It takes a lot of different things. We need the government to encourage companies to create affordable AI-powered healthcare solutions. We need public and private organizations to work together to make those solutions available to everyone. And we need education and training programs to make sure healthcare professionals and patients know how to use these tools effectively.
That sounds like a huge job, but it seems crucial if we want AI to actually improve healthcare for everyone, not just a select few. What other challenges do we need to consider as we move forward?
Data privacy and security are definitely big ones. As AI systems become more integrated into healthcare, we need to protect patient data from being stolen or misused. That means having strong cybersecurity measures and clear rules about how that data can be used.
With all this data being collected and analyzed, how do we make sure patients feel okay with it? How do we assure them that their information is being used responsibly?
Transparency is so important. Patients need to know how their data is being used, who can see it, and what it's being used for. We need clear and easy-to-understand privacy policies and ways for patients to access and control their own health information. And we can't forget about the potential for bias in the algorithms that analyze this data.
Right. We talked about that earlier. AI can actually make existing biases worse if we're not careful about how it's developed and trained.
Exactly. We need to be sure these systems are designed to be fair and equitable for everyone. That means we have to constantly monitor and evaluate them to make sure they're helping all patients equally.
It feels like we're on the verge of a whole new era in healthcare, one that's full of possibility but also comes with big challenges and responsibilities.
I think that's a great way to put it. The future of healthcare is being shaped right now, and all of us, researchers, developers, doctors, nurses, policymakers, and patients, have a role to play in making sure AI is used ethically and effectively to create a healthier world that's fair for everyone.
This has been such an eye-opening conversation. The potential of AI in healthcare is exciting and a little bit scary at the same time.
I agree. It's a powerful tool that could completely change how we diagnose, treat, and manage diseases.
Yeah.
But we need to be careful and thoughtful about how we use it, always putting patients first and making sure these advancements benefit all of us.
Well said. Listener, we've covered a lot in this deep dive. We've explored the incredible potential of AI in healthcare, but also the critical need for careful evaluation, thoughtful implementation, and a constant focus on ethics. As AI becomes a bigger part of our lives, especially in healthcare, it's up to all of us to stay informed and engaged in this conversation. The future of healthcare is being shaped right now, and your voice matters. Thanks for joining us.